like to welcome Emily Feit and Dr. Robert Boostanfar to Thinking Aloud. Emily Feit is a Los Angeles native who received her undergrad degree at the University of Arizona and her master's of social work from Yeshiva University in Manhattan. As a licensed clinical social worker with a clinical emphasis on geriatric medical care, Emily has spent her professional career focused on the chronically ill. Philanthropy and volunteering are pillars in Emily's life. Emily and her husband, Alan, established the Fight for Kids Fertility Loan Fund, a program of the Jewish Free Loan Association in 2013 to assist in alleviating the financial burden of costly in vitro fertilization treatments. And a cool stat about Fight for Kids is that since its inception of the fund, the organization has made 342 loans for a total of $5 million as of the end of last year, which is incredible. Emily was also recently published. This is her first children's book entitled Before We Held You in Our Arms. I'm holding it right here in my hands, which touches on the emotional journey of infertility prior to parenthood, even beginning. And this book is what has prompted this conversation that I have wanted to have for a long time about this very important topic. And I want to welcome Dr. Robert Boostanfar, who earned his undergraduate degree from the University of California, Los Angeles, and later smartened up and went to the medical school at the University of Southern California in 1995. Go Trojans. He completed his residency of obstetrics and gynecology in 1999 and his fellowship in the Division of Reproductive Endocrinology and Infertility in 2002 at the USC Los Angeles County Women's and Children's Hospital. Dr. Boostanfar has been published in many publications and has given presentations on his studies in the US, Canada, and Italy. He recently was a principal investigator in the largest randomized controlled trial ever published for IVF in the Journal of Human Reproduction. Dr. Boostanfar is active in well-known professional organizations, including American Association of Gynecologic Laparoscopists, the American College of Obstetricians and Gynecologists, the American Society for Reproductive Medicine, as well as the Pacific Coast Reproductive Society. During his time at HRC Fertility, Dr. Boostanfar has made multiple television appearances, including Keeping Up with the Kardashians, Good Morning America, CNN, the Learning Channel, as the resident doctor on The Little Couple, KTLA, CBS, and has been featured in People Magazine and Vogue. Dr. Boostanfar has received numerous awards, including Top Docs Los Angeles, Vitals.com's Patient's Choice Award, as well as Vitals.com's Compassionate Doctor Recognition. To learn more about him, visit havingbabies.com/physicians. It's my pleasure to welcome you both to Thinking Aloud.
Thank you, Rabbi.
Thank you so much.
It's an honor to have Emily on, and Emily and Alan are also members of Valley Beth Shalom and have been friends and supporters since I arrived day one for the last 2 years. So the story begins of this interview because Emily told me all about her new children's book. But even before we get to the book, Emily, could you share with all of our viewers your personal story? Because the book reads as very personal, and it's about a couple who's on a journey trying to have children. If you could share your own kind of biographical experience.
Thank you. Yes, it's very lengthy, so I'm going to make it a very abbreviated version, and it involves Dr. Boostanfar, so I'm glad you're on here with me. I actually just found, and Dr. B, this will look quite familiar to you, but it's basically my whole folder of all of the treatments and the tests that I had in seeking to become a parent. So basically, we got married in 2008, and I myself have a diagnosis of PCOS, which is polycystic ovarian syndrome. Am I saying that right? And I knew that I was going to have a little bit of trouble getting pregnant and having kids, but I didn't think that it would be this difficult and this lengthy. Basically, I started off just under the care of my OB and was given medication to help me ovulate and regulate that, and that didn't work. So I turned to artificial insemination with Dr. Boostanfar twice. That did not go as planned. And then I had, over the course of about, I would say, 2+ years, I had 7 in vitros, and within that, I had 2 miscarriages. One of them was actually around 10 weeks. I remember that day, Dr. Boostanfar, when he had to deliver that news to me, he was white as a ghost. It was one of the worst days ever. But basically, we had 7 in vitros with numerous tests, procedures. We actually had sought clinical second opinions from doctors in New York and doctor in Colorado, even considered actually going to Israel for treatment because we were so desperate. And then finally, through a frozen IVF cycle, about 2.5 years later, we had the twins. So it was a very, very, very lengthy process. I assumed it would be somewhat bumpy, but it was extremely arduous. It was a hardship. It was a lot of loss and a lot of disappointment and a lot of sadness that came along with it. And a ton of obviously hormones and shots and medications. And the pregnancy itself actually is a whole other story. It was not easy. You would think someone who had gone through 7 in vitros plus, hopefully would have had a pretty smooth pregnancy. It was not that at all. But luckily I do have the twins. And they are a blessing. And obviously that was Dr. Boostanfar's beautiful creation. Every year I thank him for giving me these twins. Some years I'm, with the bumps and ups and downs of being a parent. And then 2 years later, I decided that, after the twins were born, I decided that I wanted to try and have a singleton. And so I went back and decided to do in vitro once again with Dr. Boostanfar. And I believe the first cycle that I had, so this is now IVF number 8. The first one that I had was successful. I had one genetically tested normal embryo because that's a whole other process where you can make sure or hope to make sure that the embryo that you're implanting is chromosomally normal. And then I did a second round just to see if I could get an additional embryo or whatnot. And that I don't think produced any normal or genetically normal embryo. So I had one embryo that was basically my only opportunity to have a singleton. And I remember distinctly, I'm sure you remember this, Dr. Boostanfar, me coming and planning, okay, when are we going to transfer and how is my uterus looking? And basically, I remember your exact words to me, which were, in layman's terms, you said to me, imagine this beautiful lawn and you cut out a circle of it. And no matter how much you fertilize it and how much you take care of it and how much, water and sunshine, it's never going to be the same. And he basically said, no matter what we're trying, your uterus it's been so scarred and gone through so much because of the twin pregnancy, which I refer to as very, very difficult and involved a lot of hospital stays and blood transfusions. It was not easy. He said to me, I think you need to explore the idea of surrogacy. So we did. And Levi, our third child, was born through surrogacy. So I am the mother of 3 kids who were born and conceived the non-traditional way, with many years of, IVF and IUI and blood tests and numerous things that I'm probably forgetting, but it was a journey. And Dr. Boostanfar and I became very close friends because I think I was with him on and off for maybe plus years, probably even more than that. My math is not so great. But it was definitely a struggle and it was a fight. And in the end, we were able to create our family.
Well, it's terrific. The story has such a happy ending, and we all love all 3 of the kids, and we're so grateful to watch them grow up here and be a part of them growing up. Dr. Boostanfar, there's a lot of heroes in an IVF in a successful journey. It begins with the couple themselves having the courage to explore this path and overcome the, let's say, challenge, stigma, however you want to say. And part of this conversation is about debunking that stigma. Part of this conversation is about, bringing out into the light of day the idea that many, many families, including Jewish families, face these challenges. And as a community, we have to be more open and supportive. And one of the heroes of the story is the doctor. And so Dr. Busenfar, when the fights came in, but really the question is when anybody walks into your office for the first time, what does that intake look like? What is the family themselves carrying in terms of emotional concerns and how comfortable are they with the conversation, and how do you introduce this whole topic and talk to them about their options?
Well, Rabbi, every couple is a little bit different when they come into the office, but the level of emotional capacity and physical capacity to do treatment, and sometimes financial capacity. And that's why the fights have been so generous in starting the JFLA Fight for Kids Fund. Emily and Alan's case were even more unique because I had 6 patients in my office. Oftentimes I would have Emily's parents on one side and Alan's parents on the other side. And of course, Emily's father and my father were contemporary pediatricians in the Thousand Oaks, Westlake Village area for many, many years. So it was like having my own family sitting in the office, and we would do these consultations as the treatments were becoming, more and more involved. But the answer to your question is, I would say every patient has, like I said earlier, slightly different capacities, and the doctor has to have some level of emotional IQ to understand where your patients are at. And you need to, sometimes you have to extract that information from the patient. Sometimes you have to read it from their body language or what they're telling you. And, you're more of a hero it's probably not the right word. I would say you're a coach, you're a quarterback, you're a cheerleader, sometimes a therapist, psychologist, and, obviously you're doing your medical treatment along the way. I would also add that fortunately, through efforts like Alan and Emily being very open about their treatment, I would say the last decade, fertility treatment has been very destigmatized, which is great. I remember starting this practice 22, 23 years ago. Patients would be fearful of seeing another patient in the waiting room. The Jewish community is quite small. I mean, we are a block away from your temple down the street. And, if I could tell you how many VBS families that sought treatment here, they were hesitant. And that's what we would see in the early 2000s until we started getting into the 2010 to 2020 decade, where patients talked a lot more about it. They supported each other. They helped find each other doctors and teams of medical professionals, because the nurse that's involved in the care is also very important. Coordinating with the patient on day-to-day stuff, supporting them on how to take the injections. We missed an injection here. I can't find the needle. I mean, like Alan and Emily said, it's an arduous process, and there has to be a big team of professionals. So the doctor kind of has to understand where the patient is at, how to give them their level of support within the clinic, and then also make some recommendations on how they can get some support outside the clinic.
I mean, the first mitzvah we're given in the Torah, we're commanded to pru, to be fruitful and multiply, right? So this is a value of the Jewish people, is for couples to get together and have children. And so, this is a challenge, and this is one that we've taken on as a Jewish people on many levels. So if you could just, for example, for those people who don't know, Israel is a right to give birth state. So that's how our values get played out in our nation state in terms of a legal system. And you see it play out in the Bloomberg Center at Hadassah Hospital. Here, Reform, Conservative, Orthodox, is there a difference in terms of how people approach and how you handle different families when they come in for treatment?
I would say it's a great question. Reformed and conservative couples, when they come in, they have pretty similar goals, desires, and needs. It's really more geared towards outcome. You know, what is the best and safest and most effective way that we can, start our family? With our Orthodox couples, there obviously is a lot of, rules, laws, and regulations around, what we would call kosher IVF or kosher fertility with the menstrual cycle and what times of the menstrual cycle it's okay to conceive and going to the mikvah. And the treatment, once it's done, has to be, for lack of better terms, rabbinically supervised. And so fortunately, we do have in Los Angeles a partner that we work with within the PUA Institute that will send representatives here to basically follow the entire process to make our Orthodox patients comfortable that the reproductive treatment is following the Jewish laws and traditions so that when they conceive, they feel that all their needs have been met. And it's interesting because even surrogacy, and Emily was mentioning this, I've had Orthodox couples struggle a little bit with surrogacy. And there is some debate within Jewish law. Does the surrogate need to be Jewish?
Right.
For the baby to be Jewish, right? You remember some of this stuff?
I mean, it happened to us. It was definitely a conversation. Actually, it came back to prior to your time, Rabbi Nolan. It came to be an issue that affected our family, and we actually sought counsel with the VBS rabbinic team about whether or not Levi was technically Jewish when he was born and the need to convert him, because it was definitely an issue. You thought you had gotten through, the whole fertility aspect and you had been comfortable with your decision, and then there lay before you another decision as to what you're going to do with him in terms of his religious identity. So it sort of was, things were kind of coming at you from different levels, and you have to decide what you're comfortable with and what he's going to face going forward as a Jew.
So what was the rabbinic decision by VBS? I forgot to ask you this.
That's a good question. So initially, actually, I had wanted Levi to be converted under Orthodoxy, because I thought to myself, what happens if he wants to move to Israel and go to yeshiva and become from? And so I didn't want anyone to question who he was, his origins, how he came to be. It was sort of, I think it had a lot to do with my emotional status in terms of acceptance, because he had been born a non-traditional way. And actually, we did pursue that initially. It was sort of, we went outside of the VBS realm with another rabbi that had tried to help us pursue Orthodox conversion. And we were told basically, because we weren't Orthodox Jews, that converting him under Orthodox style or Orthodox regulations was consistent with our religious practice. So actually, we spoke with the rabbi at VBS, Rabbi Farkas, actually, and he gave us really outstanding advice, which I think any rabbi at VBS would have given us now if we were faced with a situation. He said, basically, are you a conservative Jew? We said, yes. He said, you need to hold true to your own values and how you practice and what you believe and what your family observes. And that really spoke to us. And actually, we ended up converting him, and he went through the whole process, but I have all the paperwork, and he's now an official Jew. So we had to do that.
Because you used a non-Jewish surrogate, and I just want to close that for people, right? So Judaism judges the birth of the child according to Jewish law, and again, this is contested. There are multiple opinions on this, but overriding principle is that it is out of the birth canal of whatever child born that determines whether or not that child is Jewish or not Jewish, whether the child needs to be converted or not. So if you use a non-Jewish surrogate, then the child needs to be converted as a Jew, and it was outstanding advice.
I had no idea about, I didn't know that that existed. And it wasn't something I ever contemplated at that point. And throughout my journey, it was like, I don't care where the children come from. They can drop from heaven. But I was grateful that I had this opportunity and the mikvah and the whole rabbinic process to say, hey, we want him, we love him. And it was just a formality. And actually, it was a really nice experience.
This is one more kind of support or proof that the Jewish tradition views birth beginning at birth, life, I should say, beginning at birth, rather than life beginning at conception, right? So it's not actually the fertilization of the egg. I'm going to get all of this wrong because I'm not a scientist, excuse me, doctor, but it's not actually the fertilization that Judaism views as the beginning of life. It's actually the birth that Judaism views as the beginning of life, and that's why all of this hinges on the moment of birth itself. And that's kind of the big principle involved in all of this. But I'll also add that the volume of halakha or Jewish law that has been written, both in Orthodox and the conservative movement, about IVF really reveals what an important topic this has become for the Jewish people at large.
You know, it is fascinating, Rabbi. It's like the Constitution, right? They wrote the Constitution hundreds of years ago without the foresight of knowing how our laws would be interpreted hundreds of years later. Now we're talking about a document that's thousands and thousands of years old. They could not have possibly imagined the reproductive changes that would occur that another woman, Jewish or non-Jewish, would carry for a couple, or even other topics like sperm donation and egg donation, etc. So there is a huge amount of literature written, and the interpretations are slightly different from rabbinic principle to rabbinic principle. But it's nice to see that there's an effort there towards procreation.
Yeah.
And, you know, I think that we're seeing this in a lot of Judeo-Christian values. Even the Catholic Church has made some progress, not as much progress as the rabbinic councils have done. But the goal should be to help couples, you know, bring their families together in their faith. And so I applaud, you know, all the rabbinic efforts that have been made to bring, you know, couples together and families together like this.
To speak on behalf of rabbis everywhere, thank you very much for all the credit. Let's talk a little bit about before we held you in our arms. What was the genesis of you becoming a children's author? I actually don't, when I read this book, I don't think that it's necessarily a book for children as much as a book for adults.
Correct.
So tell me about the book and the genesis of the book.
You know, I have to laugh that you call me a children's author because I'm like, who wrote that book? I have no idea what you're talking about. And then I look at this and I'm like, okay, that has my name on it. So yes, I am a children's author. So as you had stated earlier in your opening remarks about me being a licensed clinical social worker, and my focus always was on geriatrics. And then we had this, you know, 2 to 3 year process. Actually, I think it's longer. I think my math might be wrong. I think it was actually around 4 years. Long experience with infertility, a lot of grief, a lot of trauma, just a lot of internal and emotional anguish and pain. So during COVID, so there is some blessings in COVID, very small, but Alan had turned to me, Alan, my husband, and basically said like, hey, you are not going into the nursing homes right now. It's COVID. We're not going into them. You are a licensed clinical social worker. Why don't you open up your own practice, focus on infertility? And my automatic response was like, nope, I'm not interested. We have the foundation. I'll speak to anybody about infertility. I'll listen. I'll be a listening ear. I can do it on a volunteer basis. And he kind of pushed me. And so got to a point where I was sort of open to the idea. So I entered a virtual postgraduate class for mental health professionals who wanted to focus on reproductive psychology. And I took that class, I think it was September of 2021 through June of 2022. And with the hope of maybe convincing myself that I could open up a practice, I could speak with some individuals or couples who are going through infertility. And ultimately, I decided against it. And the reason why is because I wanted to be impactful in a grander scheme and a bigger level. And I felt that I could do that either with groups or possibly a podcast or something like that. And I happened to be on a plane. It's a strange story. I know Dr. Boostanfar knows this story. We were going to Mexico, of course, and I'm sitting on the airplane and we're delayed. And take my phone out and I'm like, I have a book idea. Because what I found, and maybe things have come about, but at the time I found that there wasn't children's books or picture books that spoke about the parents or parent journey, emotional journey. It was a lot of books that tried to explain assisted reproductive technology through animals. That's what I felt. And that I thought was a good conduit, a good mechanism for explaining how children were conceived in the non-traditional way. But I wanted really to focus on the emotional journey, what parents were experiencing, and explaining it in a way what ultimately would be palpable for the children and had a message of overarching love and desire and resiliency, which I think parents can relate to on a daily basis. These are things that, you're going to have things that come your way, hardship and whatnot, but you need to push through and hopefully at the end there's light at that tunnel. So I jotted in my iPhone notes. I sort of was a very rough draft of my book. I handed it across the aisle to Alan. Alan read it and he began to cry. Now he'll be embarrassed that I shared this on the podcast, but that's okay. And I'm like, okay, I guess I have an idea. Mm-hmm. So I found an editor on my own through a platform. She helped me kind of reword and craft it a little bit so that it could be understandable in an age appropriate manner. And I was put in touch with a publishing house through a friend, and I sent them my manuscript. And that was on a Friday, and on Monday I had a publishing contract, which I was blown away by, because she said, let me take the weekend to be able to research if something like this exists. And she said to me, there's a void in this area, and I think that this is the right mechanism. So from start to finish, I would say it was about a year and a half. The writing of the words was very quick. As I had explained, it came to me, it was edited, I sent the manuscript, it was done. What took the longest was the illustrations. And the illustrator I found through the publishing company. I never was in direct communication with the illustrator. So imagine trying to illustrate a book with someone who lives across the world. So you have a time change. It was done electronically and through the publisher. So the editor was the one, we sort of mapped out our ideas and then it got sent to him. And then it was a lot of back and forth. There was, discussion of how do you illustrate an abstract concept of sadness and heartache and desire. And then there was a discussion, was it going to be based upon our journey? Was it going to be the same couple? Which you can see, this is loosely based on
you sent a picture of yourself and Alan to the illustrator? Yeah. Great. So let me just read. It's a beautiful book. I'm going to read you a couple pages. Okay. And because I think that the book reveals that each family's journey is multi-layered, and that there is a physical part of this journey in terms of getting pregnant. But I also think that the book reveals that there's an emotional journey and there's a spiritual journey going on at the same time. And I'm going to ask you both about this in terms of how couples, feel their way through this kind of journey. During our journey, we tried our hardest to smile, even when our hearts were blue. There were days when we cried and felt sad inside. All we wanted was a baby and did not yet have you. There were days when we felt jealous. Sometimes we felt angry. Why were things so hard for us? All we wanted was to be your parents. There were moments we lost hope. There were times we worried our dreams would not come true. I mean, I teared up when I read that for the first time.
Up again, and I wrote it.
and Dr. Boostanfar, how do you play therapist, cheerleader, quarterback, all of those things, as all of those different roles, as the couple actually makes their way through this kind of journey. I mean, it feels arduous, it feels long and arduous, and that's kind of what the book reveals as well. And and I'd imagine that a lot of that plays out in your office.
Plays out in the office all the time, Rabbi, and there's no class in medical school regarding it. People skills are not something that's that there's a class for. Your best bet is hopefully you were equipped as a human to understand the trials and tribulations of other humans, and then through observation of interactions with your peers and with your mentors, that you can develop a system or tools to help your couples get through this. And part of the success of getting a patient to the finish line is keeping them in treatment so that you can get to the goal. To some degree, fertility has a large mathematical component to it. Some couples are high prognosis and get pregnant very quickly. And like other aspects of medical care, depending on the severity or the difficulty of the disease, it might take longer to achieve treatment and success. So you have to really read the signs of where your patients are struggling, point out these observations to each of the partners or family members that are, intimately involved. Sometimes, patients bring their sister, sometimes they bring their mom. Sometimes the husbands are struggling if it's, male related. Predominantly a third of IVF and a third of fertility treatment is solely based on male. And sometimes the guys just don't have the same support network as the women do. The women have talk to their moms, their sisters, their friends. Sometimes the guys they have nobody to talk to. They're not going to tell their friends that their sperm counts are low, and it's not a typical conversation fathers have with their sons. So the dynamics are very complex, and every single situation is very, very different and can be very highly labile, and you have to be really careful and calm and collected and try to gather all the energy and move these patients forward.
What is the hope for both of you as a final thought for somebody who's watching this, who is considering IVF or considering a first appointment, or is caught themselves in this kind of blue period of the book? They're in the middle of the journey. What words of advice do you offer them?
I would first start off with saying that educate yourself regarding your fertility status. If you are not educated about the status of your fertility, whether it's good prognosis or intermediate prognosis or poor prognosis, you cannot act. And if you're opting to defer your treatment after you've educated yourself so that you don't have regret years later. I can't tell you how many patients sit in front of me and said, if I'd only known this a few years ago, or if somebody had told me this, I might have gone down a different route. And I think Emily and Alan, just based on their personality, they're always educating everybody. I mean, I'll have a lot of their, the Feits told me to come see you. And even if it's just for one visit, just to help them get, stay on course. Where should we go? What should we do? Don't move your embryos. That could be dangerous. You could lose them. Keep your embryos at that current location and seek another opinion within that practice so that maybe you could get to your goals. Or yes, you can bring your embryos for surrogacy in this state, not in that state. Education is very, very big, and it's not that difficult. Access is very good in many, many states, especially in larger states like California, to get fertility answers. And, I think access is getting better even for our younger couples. Many, many big companies like Yahoo and Google and Apple and Netflix have started providing some fertility coverage and services for the women in their organizations so that they can cryopreserve eggs in their 20s or early 30s, so that when they're in their late 30s or 40s, they are potentially struggling less with fertility treatment. So education is big. Really considering also fertility preservation is big. If you're struggling with chronic disease or cancer, do not be afraid to contact a fertility specialist immediately to freeze sperm if you're doing chemotherapy, or freeze eggs if you have some kind of malignancy like lymphoma or breast cancer that we see many times in reproductive age women. And, if you have a lot of faith-based concerns, whether it's Jewish, whether it's another faith, consult your rabbi and see a fertility specialist that has a wide range of experience treating couples like this and are able to help them navigate. But you got to make the first appointment. I would say that's the most important thing. If after that your treatment doesn't really move on, at least you've been educated and you've made an informed decision about your reproductive choices.
Thank you. Emily, final thought.
Final thought. I have many, but I'll make it distinct. I don't think that infertility defines you. Your struggle doesn't define you. And this is a significant loss. And I think that oftentimes we think that loss is something that can be physical or can be seen. But a lot of individuals are suffering in silence, and there's compounded losses and compounded sorrow. There is help out there. I know, learn from what I did, and don't do that, which is I kept it so silent and I kept it so close to my heart, and I didn't reach out to others because I felt so embarrassed and so humiliated and so ashamed of what I was suffering with. I didn't ask for it, obviously, but there is a growing amount of help out there, whether it's financial or whether it's just social support or emotional support. There's stuff in person, there's stuff on social media, there's virtual groups. There is a mechanism and an avenue to support you throughout this journey, whether it be at the beginning or during. It's definitely, it's a process. But again, it doesn't define you. And I think that there is value in this process. There is value in the struggle. There's value in the resiliency, and there's the value in not giving up hope. And I think that's an important message, is not that you struggled necessarily with infertility or you are struggling, but look how much you gave of yourself and you really were able to push through, and you have a message, which is the important part of it, which is that you may have suffered and you may have struggled, but at the end, in a way, you're victorious, hopefully, or maybe you've accepted the status that you're at, but there is value in the experience. And there are people and there are organizations that are there for you and want to connect with you. So please don't be ashamed of this. It's so common, and there is a community out there willing and ready to wrap their arms around you.
Thank you both for spending the time with me today, and Emily, thank you very much for your courage and for offering this message to the greater community and to the world about the journey and sharing your experience. And Dr. Boostanfar, thank you very much for everything you do, and thank you for helping the enrollment in our ECC and our day school. We really appreciate it, and God willing, you'll create many, many more Jewish children, and because our people desperately needs it. And so thank you for everything you do and the role that you play in this journey for so many.
With pleasure. Thank you, Rabbi.
Thank you. Thank you both. Thank you, Rabbi, for bringing attention and awareness to this. I really appreciate it.